I must first start with our communities, because that's where we have felt much more impact, in that we could have lost more lives. Our facilities would not have been able to handle the influx of people who were affected by COVID-19. But WHO assisted us a lot to save even more lives, and we're grateful of that.
Before we decentralized, we had challenges. The cases were becoming too much for us. We were overwhelmed with the work now of catching up with the case investigations that we had to do.
So it was very, very difficult for the district to start picking up in terms of screening, contact tracing. So there were a lot of things that they didn't know really, and they were not really implementing very well. I think that's where the struggle started. But it was at that time where WHO actually offered them epidemiologists. So that was the best, because when they arrived there, they could do the reports, they can present on behalf of the district. The district started getting comfortable in actually interpreting their own reports, actually been presenting their report.
WHO personnel came and we said to them, we want to take this now to the clinics. We want to ensure that each town is managing their own COVID cases. Our epidemiologist from the World Health Organization, we have incorporated her in ensuring that we have good data and data analysis from our HIV and AIDS program. She is working on the expanded programs on immunization. She's also assisting us with the TB program to check the trends, to say, why is the TB not doing well? Why do we have such a high loss to follow up?
Tabung-Futsanyane was one of the districts that has the highest number of mortality. We were assisted through the World Health Organization of deploying some of Dr. K.K. Mukwena as an epidemiologist. We were able to analyze our own mortality, and through such type of an analysis, we were able to change our approach, and we were able to respond and be proactive in order to reduce the mortality.
During the peak of COVID, I was summoned to then join the surveillance team at the district level. I worked with Dr. KK very closely. You know, he was always available to analyze, and we will work on way forwards and how to analyze the data, how to, set a strategy and how to go forward on improving our performances. So to me, WHO was really a great help.
A lot of people died at home, and only when we did post-mortem swabs, we only realized at that point that the people were COVID positive. WHO assisted us with a data system. The nice thing about this system, we are able to use it for surveillance. So we'd know in the community where the deaths are happening, where the COVID is the highest, so that if we are doing our education drives, we'd know exactly which part of the community to target the most.
At one stage, we didn't have those body bags yet with the window. They were very angry at us because they couldn't see their beloved one. And it was difficult for them. They couldn't dress them, they couldn't do anything until we got the PPE from the World Health Organization to help us to make it easier for the families to get that final goodbye to their loved one.
We're also grateful that WHO has built capacity in our department, and we are better off as a department now to deal with other pandemics that may come, and also to deal with the health challenges.